Welcome to the COVID-19 Q&A with Dr. Jan. We've received questions from all across Australia today, and Dr. Jan is here to answer them. G'day, Dr. Jan.
G'day, Andy.
So we've had over 170 cases, locally acquired transmissions in the last 24 hours to 8 p.m. last night, which is extremely concerning.
And particularly still we have quite a large number of people who have COVID, who haven't known they've had COVID and have been in the community. So it's so important for people to remember that you're actually able to transmit COVID before you have symptoms. So you sort of say, no, I'm fine, I can't have COVID. It doesn't work. You can actually give people COVID for up to 2 days before you get those symptoms. So please, it's so important that you stay at home, which means under our own roof. We don't have people visiting us to and fro. We visit virtually. We use our phone. We reach out through social media. We do everything except for going into somebody else's house. Even if we've got a close family where we usually live among the 3 houses together, at the moment, one house, one group of people. Next house, a different group of people. And just remember those symptoms of COVID-19. They can be very vague. We're seeing with Delta strain, headache, sore bodies, as well as runny noses. So not your classic cough or change in taste or smell. They, of course, can happen with COVID-19, and including the Delta strain. But even if you think, oh, it's just a bit of a headache, I'm a bit run down, I've had a sniffle, please go and get tested. It is so important.
Definitely. Now, Dr. Jan, in regards to the new vaccination centre, Kat has a question about how do they work? Do you just walk in with your medical records? Are they really large? Can you get lost in there?
So all of our vaccination centres have wayfinding appointments, wayfinders, so people who can help show you around the centre. The key thing is that we've got some walk-up centres. For the walk-up centre, you don't need an appointment. You don't need a Medicare card. You just need yourself. If you've got your Medicare card, bring it with you because that makes keeping a record of your vaccination easier. But if you don't have a Medicare card, you might not be eligible for Medicare. You may have put it somewhere and you just can't find it at the moment. Don't let that be a barrier. Roll up to those vaccination centres. Other vaccination centres are appointment only, so please make sure before you attend those centres that you actually have an appointment to go.
Yeah, right. Definitely check the immunisation website as well.
Absolutely.
Eligibility website.
Absolutely. So the COVID vaccine eligibility checker will tell you where all those sites are. We don't have as many walk-up sites here in New South Wales as some other places do, but it's a 3-day wait at a lot of the clinics. So please do just book in, and if you are in the area where that new clinic is, or if you hear about a pop-up clinic near you where vaccines given out, go for it.
Christine's got a question about whether there are any rare medical conditions that would stop you from getting the COVID vaccine.
Yeah, Christine, there are some rare medical conditions. So there are some medical conditions where we ask people to see their immunologist before they are. There are people who've had severe allergy before. They can usually get the COVID vaccine, but depending what they've been allergic to. Some people have been treated for breast cancer, for example. Some breast cancer treatments, a very small number, can cross-react. So it's really important that, people, if they're worried about their allergies and past reactions, they talk to their GP. There are also some people who've had a very specific immune clotting disorder called antiphospholipid syndrome or heparin-induced thrombocytopenia. They can't get the AstraZeneca vaccine, but they certainly can get the Pfizer. But just about everyone else can get those vaccines. Some mast cell disorders, you should talk to your doctor. So generally speaking, the vaccines are safe and appropriate. It doesn't matter whether you've got cancer, it doesn't mean whether you've got rheumatoid arthritis, Crohn's disease. It's much better to be vaccinated than not.
Lana would like to know what happens between the 3 to 4 week waiting period in between each vaccine. What happens during that time?
Sure. So your immune system starts making antibodies to that first vaccine that you've had. And so you've had that vaccine, it leaves your body and your immune system's going, okay, I'm learning how to do this. When we give it the second shot, it reminds your immune system you really know how to do this, and so your immune system gets that extra boost and really gets a really good protection for that time. So that's why you have some protection after the first dose, but the really good protection comes after the second dose.
Right. So important to have both.
Absolutely.
James would like to know if you've already had the alpha strain, are you protected from getting the Delta strain?
James, I wish we were. Unfortunately, what COVID has taught us is that if you've had COVID in the past, your subsequent infection may be less severe. but you can still get COVID again. And in our context at the moment, you can't just get COVID again, you can also give it to people again. So yeah, even if you've had COVID once, it's still important to get tested if you get those symptoms back.
Nasty virus.
It's a sneaky one.
Bryce really wants to get the Pfizer shot, but he's worried about heart inflammation. Do you know much about that?
Yeah, so it's really, really rare is the first thing to say. It's not an uncommon thing when we get any viral illness. It could be a cold or it could be the flu. Some people do get inflammation around either in the sac around the heart or in the heart muscle itself. It's largely self-limiting, so it's something that your body fixes itself. It doesn't usually cause major problems for people, and it is incredibly rare. So at the moment in Sydney, the chances of you getting a cold virus or the chances of you getting COVID are much higher as a cause of that particular problem than the vaccine itself. So as long as you're not living in a plastic bubble for all of your life, it's much safer to have the vaccine than it is to risk all of those things, plus long COVID, plus all the other things with COVID itself. So certainly really good to get the vaccine.
In regards to the AstraZeneca vaccine, is it okay for breastfeeding for women under 40?
Absolutely. It is completely fine for breastfeeding women. You don't need to pump and dump. It's fine. You can just keep feeding, and there's some possibility that some of your own immune response, just like with other diseases, your own immune response may actually help protect the baby as well. So certainly you can breastfeed right through it.
Question in from Sherilyn. She's asking, can someone currently taking chemo, can they go get the vaccine?
Absolutely, and you should go and get the vaccine. Just talk to your oncologist or to your chemotherapy nurse, and they'll be able to tell you when the best time it is for you to get the vaccine, when you're likely to get the best immune response. So, but please, if you have got cancer, if you're on chemotherapy, you should be getting vaccinated. You are at much higher risk of a bad outcome from COVID, and so the first vaccine you should get is the one that you are rolling up your sleeve for as soon as possible.
Now, Dora's wondering, is it true that the Pfizer vaccine only lasts 6 months and then you're required to have a booster?
No, that's not true. What we're talking about with some of these boosters is, as you know, we're getting some changes in the COVID virus, and when the virus changes, the ability of the vaccines to protect us may decrease. So the idea of the booster is to help us fight new strains. So for example, the vaccines are about 90% effective against old COVID and about 70 to 80% effective against Delta. We want to get us back to where we were against Delta. So that means they change the vaccine a little bit to make sure that it matches what's circulating, and then we get vaccinated again, a bit like we do with flu each year. And I don't know whether we'll need it each year. We're still learning, but you certainly will have protection after 6 months.
Okay, good to know. Belinda is asking if her teenage daughter gets the vaccine, is that going to harm her chances of having children in the future?
Absolutely not. In fact, it's possibly going to enhance her chances of having children in the future because she's unlikely to die from COVID. So, it doesn't change your genes. You don't pass it on to a future pregnancy. If you have your COVID shot today and you're pregnant tomorrow, no problem. If you're pregnant and you have your COVID shot, no problem. And if you've had your baby and you're breastfeeding, no problem. It is really safe and really important to have the COVID vaccination, and it's far more likely to benefit your future reproductive life rather than make it difficult.
Thanks, Dr. Jan. Now, Eva's asking, she's read that the vaccine doesn't work as well if you have an autoimmune disease. Is this correct?
Yeah, it can be correct because people with autoimmune diseases are often on medication to suppress their immune system, and so you don't mount quite a strong response. But that's not a reason to not get vaccinated. That's a reason to go and get vaccinated so you can get what protection you can. But also, if you're severely immunocompromised, if you're on biological agents for rheumatoid arthritis or for Crohn's disease, or you're on a high dose of prednisone for a neurological problem, you're actually eligible to be vaccinated, but so is your whole family. So people who are in your household are also able to be vaccinated to protect you. So we don't just protect you, we protect your family. So in my household, one of us has an autoimmune disease, we're vaccinated to protect that person.
Okay. A question in from Fern. She's asking, does the 5 kilometre bubble rule apply to giving her care to someone?
So it depends what your care is. Look, if you actually have to go and provide a service to a vulnerable person, you're able to provide that service to the vulnerable person without the 5 kilometre limit. But if it is about, can I go and see my friend? No, I understand the 5 kilometre limit is there. So have a good look at the nsw.gov.au rules. It's a bit confusing, I'll say that. It's not easy to completely fathom, but the whole idea is stay home, stay local, do not go out of your local area. And if you do need to provide care to a vulnerable person, and that doesn't mean they're feeling a little bit down today and would like to see a cat. Not that I'm saying most people are like that, but that's the sort of excuses that we hear, as opposed to if I don't go and see this person, they'll run out of food. Then there's 2 different levels of need there. So please just be really sensible and just remember that this is a nasty illness. It's sneaky. You don't know you've got it, and it'd just be a tragedy for you to spread it between lots of people.
Now, Kenny's wondering, should you be wearing a mask inside a car?
So, Kenny, it depends on who's inside the car with you. Now, if you're with your friend from the singles bubble, then you should be wearing a mask inside the car. But otherwise, we shouldn't be sharing a car with people who are not from the same house as ourselves. So if it's not your nominated single person, then you're not able to share a car, say, to go to a family picnic or for a family walk somewhere. You should be in your own car. So it's really important that we try and limit that. So, and of course, if you're in a taxi or an Uber, back seat, preferably with the window down with the mask on.
How about in regards to exercise and sweat? Can you get COVID from sweat? That's a question from Nathan.
No, you're far more likely to get it because somebody's breathing in and out heavily near you than from the sweat. Sweat is not a risk for COVID.
Right, well, our last question today is from Amir. He's asking, do I have to register my nominated person if we're creating that bubble?
No, I mean, you don't have to register the nominated person, but if somebody asks, are you this person's nominated person, and then the police finds that there are actually 6 other nominated people that they've had cause to talk to, you may have a problem. So just be really clear with the person you're saying this is. It's not a game, and I can't emphasise this strongly enough. The risks of COVID are there at the moment. It is very hard to control. You don't know that you've got it, and you can give it to people even when you're taking extreme care. So please, wherever you can, stick to as much of the, just stick to the rules, really be very careful with what you're doing, and, behave as if though the police do know who your nominated person is, and they will be checking. Behave as if though they're going to ask you something. And if you're thinking, should I do it? You probably shouldn't be doing it. You should probably just do something else that's safer and staying at home instead.
Well, thank you so much, Dr. Jan, and thank you for sending through your questions today. If you have any more COVID-related questions, feel free to tune in same time on Monday. But until then, have a great weekend and stay safe.